Okay, for the purposes of this video, I will be recording vital signs over clothes and bones. Sorry, I can't breathe. I will usually not do that, but I will be doing that for this video purposes. All right, so I will come into the room, introduce myself, do hand hygiene, and I will bring the bed up to working height, which is already there. Hi, I am Jasmine. I'm your nurse. I'm here to do your head to toe assessment. Can you tell me your name?
Candria.
All right, and your date of birth?
0622.
I'm going to check her wristband for ID purposes. Also, any allergies?
No.
And are you in any pain?
No.
And I'm going to go ahead and orient the person while I'm here and check the level of consciousness. She seems alert. Can you tell me what today is?
March 16th.
And who is our president?
Joe Biden.
And I'm going to go ahead and look at the facial affects to make sure she is happy and that everything is symmetrical. Can you smile for me? We have a symmetrical smile. It is not drooping. So from here, I'm going to check the skin integrity. So I'm going to check her skin to make sure it's a colorful compression, that there are no rashes, no bruises, no IVs that have tenderness, red, or anything that needs to be taken care of. I'm also going to go ahead and assess her skin turgor to make sure she's not dehydrated. If she was older, I would check the skin turgor over the clavicle. And then while I'm right here, I'm going to make sure her eyes, nose, and mouth are symmetrical, and also that her ears are symmetrical. I'm going to make sure that what she is wearing is there for the weather, that is correct for the weather, and that her skin is the correct color for her ethnicity, and that she's not pale, cyanotic, or dusky. I'm also going to see if she has any assistive devices over her, like does she have any contacts, glasses, stained glass eyes, does she have any hearing aids in her ear, and from that point I will check the conjunctiva of her eye to make sure it is pink, and the scleria of her eye to make sure it is white. I'm going to check her nose to see if there's any drainage. If there is any drainage throughout this process from head to toe, I will coach it. Color, odor, consistency, amount, and how the patient is tolerating it. And I'm also going to check the ears for any drainage. Make sure it is symmetrical. Since I'm up here, I'm going to go ahead and do the hearing test. I'm going to whisper. Have her say it back to me. Then I'm going to whisper on this side and have her say it back to me. Okay, all right, and then I'm going to check her mouth. You don't have to open it if you don't want to, it's up to you. And I'm going to check her mouth for make sure her mucous membranes are wet, that her tongue is symmetrical, that her uvula is midline. See if she has any dentures, any missing teeth, any odors that are fruity, foul, or if they smell like alcohol. All right, and then I'm going to move down to make sure that the trach is midline. And from here, I'm going to have her turn her head to the left for jugular vein distension to see if the jugular is distended. That could indicate right-sided heart failure. I'm gonna have you turn to the right for me so I can check the right side too. All right, thank you. You can turn your head back to the right. I'm gonna sit you up at a 45-degree angle so I can, I would have set her up at a 45-degree angle when I checked her JVD, and now I'm gonna go ahead and check, you're at 45. Go ahead and check for cardiac breeze. Make sure there's not too high of fluid going through her jugular vein. We're going to check that with the bell of my stethoscope. Hold your breath for me, please. All right, and I'm going to check the other side. And while I'm right here, I'm going to auscultate the valves of the heart with the bell and the diaphragm of my stethoscope. Aortic, diaphragm, and bell. Pulmonic, valve, diaphragm, and bell. Erb's point, bell, and diaphragm. Mitral tricuspid valve. Diaphragm and bell. And mitral valve. Bell and diaphragm, and I will check the apical pulse, which is the left fifth intercostal space mid-clavicular line. I will assess it for a minute, and the normal pulse range for an adult would be 60 to 100 beats per minute. While I'm right here, I'm going to go ahead and do range of motion and check capillary refills bilaterally on both sides. Put that one down, the range of motion over here as well. I'm gonna have her grip my fingers to do the finger test, and then can you shrug for me? Thank you. I'm gonna check the bony promises, the back of the head, the scapula, sacrum, elbows, and heels. All right, and then from this point, I'm going to assess for respiration. See if her chest is inflated and deflated symmetrically. She should have 12 to 20 breaths per minute as an adult, and I'm going to go ahead and listen to her lung sounds in 8 distinct places. Two inches below the clavicle. All right, and while I'm right here, I'm going to check for the radial pulse. And while I check for the radial pulse, I'm checking it on a 3+ grading scale. 0 absent, 1 is weak, 2 is strong, and 3 is bound. And then, as I said, with the apical pulse, we're checking for 60 to 100 beats per minute. And then on the brachial area, since we're right here, I will do a 2-step blood pressure. And in doing that, she should be 90 to 119, over 60 to 79. Okay, and since I'm right here, I'm going to ask her questions. Do you have any dietary restrictions?
No.
When was your last meal?
2 hours ago.
And when was your last bowel movement?
3 hours ago.
All right, and then I'm going to assess her abdomen area to see if it's distorted, if she has any devices like ostomies. Also, if there's any open wounds anywhere on the body, we'll assess that as well. And also see if her stomach is flat, obese, or anything of that nature. And now I am going to listen. I will start with the right lower quadrant. I'm listening for bowel sounds. With the bowel sounds, if they are 5 or below within that minute, it is hypo. And then if it is over 30 in that minute, it's hyper. And if I don't hear anything, I listen for 3 to 5 minutes before saying that it is absent. I will listen starting with the right lower quadrant into a clockwise position. To the right upper quadrant, left upper quadrant, left lower quadrant, and then I will listen to the abdominal aorta, which is to below the diaphragm, with the bell of my stethoscope, because I'm listening for abdominal buries, and then underneath the umbilicus. All right, and then I'm going to assess bladder distortion. See, the bladder is distended. I'm going to ask, is there any burning pain or discomfort when using the bathroom? Do you have any discharge? If the patient did have discharge, I would coach it. While I'm right here, I'm going to have her do pronator drip. Can you hold your hands up and close your eyes to see if they drip? Thank you, and you can lay back. All right, and from here, I'm going to go down and I'm going to check edema. And we're going to do if it's pitting or non-pitting or brawny. And then I'm going to check range of motion of her legs. And I'm also going to check capillary refills of the lower extremities. And then, sorry, that hurt. Right here, I'm going to also check dorsalis pedis pulse. And then the posterior tibial pulse. And now, do me a favor, plant your feet while I'm checking for plantar flexion, and point your toes towards your head. I'm checking for dorsal flexion. I'm going, if it was safe, because the bed is so high, I would get her up to have her check her gait. Okay. And then check for assisted devices, walkers or anything like that. And then I'm gonna have you swing your feet so I can check the respiratory on the back side. So I would check respiratory on the back side, making sure to not get it on the spine, 2 inches away from the spine in 8 places. So the spine is here. So we'll go 1, 2, 3, 4, 5, 7, 8. And I'm gonna go ahead and have you lay back so I can go ahead and assess Perla at this time. I will be turning off the light. Okay, from here, I'm gonna go this way so you guys can see. From here, I'm going to come out and I'm checking for the constriction of the eye on the right side. And I'm gonna go back out and I'm gonna check for constriction of the eye on the left side. And I'm gonna do it again from the left side and check constriction of the eye on the left side. And then I'm gonna check constriction of the eye on the right side. And I'm looking for accommodation. Can you look at the pen? And then can you look past the pen? And then with the right eye, can you look at the pen? And then can you look past the pen? And I'm gonna go ahead and do cardinal gaze. Cardinal field gaze. And follow the pen with just your eyes, please. All right, and after I do that, I'm going to assess the patient for pain again, while I'm still looking over to make sure they don't have any IVs, any open wounds, anything that needs to be addressed or miscellaneous. I will bring the bed back down for safety reasons. Do you need anything? Do you need to go to the bathroom? Is there anything I can get you?
Okay.
All right, now put the call light within reach. Side rails up ×2. All right, and then hand hygiene, and thank you for allowing me to do your assessment today.